Good morning to everyone and welcome to today's guidance section on Pharmacology 1 and how to prepare for competitive examinations like GPAT and other similar exam, railway pharmacist, pharmacy officer, drug inspector, NIPER examinations. So welcome. So pharmacology 1, pharmacology first, these are the subject which deals with drug. Drug is a substance which is used for prevention of disease or disorder. The subject scope is that to understand what drug do the living organism and how their effect can be applied for therapeutics. Pharmacology is the branch of science that deals with study of how drug interact with living system and their effect. The subject cover about drug mechanism of actions, mean that is pharmacodynamic, and deals with absorption, distribution, metabolism, and excretion. So that is pharmacokinetics. Pharmacokinetics means study of absorption, distribution, metabolism, and excretion, along with adverse effect, clinical uses, interactions, and doses. So these are the scope of pharmacology subject. Objective: this subject helpful for pharmacological actions of different categories of drugs, also different mechanism of actions. Also this knowledge is helpful for prevention and treatment of various diseases, and also observe the effect of drugs on animal by simulated experiments. So first unit, that is in that unit 1, general pharmacology. Pharmacology is a branch of science that deals with study of interaction of drug in living system. In that unit we learn about historical landmarks and scope of pharmacology. So scope, ड्रग डिस्कवरी, म्हणजे एखादा नवीन ड्रग डिस्कवर करायचा असेल तर त्या कंडिशनमध्ये पण फार्माकोलॉजी जर माहीत असेल तर ड्रग डिस्कवरी. ॲडव्हर्स ड्रग्स डिटेक्शनसाठी फार्माकोव्हिजिलन्स, डिटेक्शन मॉनिटरिंग ऑफ abnormal response of drug or adverse drug reactions. So these are also scope. Also nature of sources of drug means plant sources, animal sources, mineral sources, synthetic sources, semi-synthetic sources, biotechnological sources. These are the different sources of drug. Essential drug. Essential drugs means those drugs which meet a priority healthcare needs of majority populations. Route of drug administration: oral, parenteral, topical, buccal, sublingual. These are the different route of drug administration. Dose response relationship, therapeutic index to measure safety of drug. Therapeutic index is helpful for to measure safety of drug. Agonist, antagonist, opposite actions. Combined effect of drug means two drugs simultaneously administrations, that net result means combined effect of drug. Factor modifying drug actions means these are those factors which modify the drug actions, means age, body weight, route of administration, time of administration. Pharmacokinetics, study of absorption, distribution, metabolism, and excretion. Next, membrane transport means how to drug transport, passive diffusion, carrier mediated transport, endocytosis, pinocytosis. Next, enzyme induction means synthesis. Enzyme induction means increase the synthesis of enzyme, and enzyme inhibition means decrease the synthesis of enzymes. Next, introduction to kinetics of eliminations. The first order kinetics, zero order kinetics. So these are the syllabus of unit 1. We'll discuss about on the competitive examinations multiple choice questions. First question is that which of the following is the correct point regarding pharmacology? Which of the following is the correct point regarding pharmacology? So pharmacology, option A is the study of drug and their effect on living organism. Second, the study of toxic effect of drug. C, study of how drugs are marketed and sold. And D, the study of adverse effect. So pharmacology first, study of drug and their effect of living organism. Study of drug and their effect on living organism. A is the correct. Study of toxic effect means that deals with toxicology. Second B, that is toxic effect deals, that is toxicology special branch. Next, study of how drug marketed and sold, that is also not. And study of adverse effect, that is pharmacovigilance. So you have to remember. Next questions. Question number second, who is considered the father of modern pharmacology? Who is considered the father of modern pharmacology? A, William Harvey. Second, Paul Ehrlich. C, Ostwald Schmidberg. And D, none of this. So Paul Ehrlich is the chemotherapy. Oswald Schmidberg is the correct answer. Is the modern pharmacology, father of modern pharmacology, Oswald Schmidberg. C is the correct answer. Next, which of the following is an example of drug derived from natural sources? Option A, paracetamol. Option B, quinine. Option C, sildenafil. And D, none of these. Question is that which of the following is the example of drug derived from natural sources? So paracetamol is not. Quinine. Option B is the correct. Quinine, cinchona bark. Obtain quinine and quinidine. Next, the term essential drugs refers to drug that essential drugs म्हणजे आवश्यक, essential means आवश्यक drugs. Option A are used only in emergency situation. B are required to meet the healthcare needs of the population. C are considered non-prescription medications. And D are the most expensive drug on the market. So option are used in emergency situations, not. Are required to meet the healthcare needs of the population, are considered non-prescription medication. D are the most expensive drug on the market. So D is cancelled, A is cancelled. Option B is the correct. Essential medicine are those medicine which meet majority healthcare needs of the population. That is the correct answer, B. Next, which of the following route of drug administrations? Option A, oral. Option B, intravenous. And option C, topical. Option D, all of this. So these are the all have route of drug administration. Orally, tablet we administer. Intravenous, IV. Injections, topical. Cream, lotion, topically will apply. So option D is the correct answer. Next, dose response curve. Dose response curve. Dose response curve show the relationship between dose of drug and option A, therapeutic index. Option B, the maximum impact of drug. Option C, drug half-life. Option D, rate of absorption. Dose response curve show the relationship between the dose of drug and maximum effect of drug. So option B is the correct. Next, which of the following describe the therapeutic index of drug? So therapeutic index, it provides the safety of drug. Option A, the range dose that are therapeutically effective. Option B, the ratio between lethal dose and effective dose. Option C, the dose at which drug produces maximum effect. And D, the concentration at which drug reaches therapeutic effect. Therapeutic index, it is the ratio between the lethal dose and effective dose. So B is the correct answer. Next, which of the following is true about competitive antagonist? Competitive antagonist. Option A, they are bind irreversibly. Option B, they can be overcome by increasing the concentration of agonist. Option C, They increase the effect of agonist. Option D, they do not affect agonist affinity. They can overcome by increasing the concentration of agonist. Antagonist means opposite actions. Example, that is morphine. When we administer the morphine as analgesic purpose, we overdose of morphine, poisoning cases, that is naloxone antidote. That naloxone will overcome the morphine activity, that is called antagonist. They can overcome by increasing the concentration of agonist. Next, non-competitive antagonist. Bind to the same site of agonist, can be overcome by increasing the agonist concentration, bind to the different site and reduce the receptor ability to respond to the agonist. And D, have no effect on drug maximal response. Non-competitive. So option C is the correct. Bind to the different site and reduce receptor ability to respond to the agonist. Next, when two drugs are administered together, question is that next, when two drugs are administered together and their combined effect is greater than the sum of their individual effect, it is called A, synergism, B, potentiation, C, antagonism, and D, additivity. When two drugs are administered together and their combined effect is greater than the sum of their individual effect is called synergism. Yeah, answer is correct. Antagonism means opposite actions. Synergism means increased activity. Next, which of the following is the major mechanism by which drug cross biological membrane? Which of the following is the major mechanism by which drug cross biological membrane? A, simple diffusion, B, active transport, C, passive diffusion, and option D, all of these. So these all following major mechanism by which drug can cross biological membrane, that is simple diffusion, active transport, passive diffusion, D, all of the above. But passive diffusion, in that 90 to 95% drugs will crosses this membrane. Lipophilic, majorly lipophilic, there is no need of energy. In active transport, in that vitamin B12, water soluble vitamins, it crosses, there is required energy. Next question, which factors affect absorption of drug? First, drug formulation, blood flow to the absorption site, particle size of drug, and D, all of the above. Which factors affect absorption? First, absorption म्हणजे काय? Absorption means movement of drug from the site of administration to systemic circulation. Absorb. Which factors? Drug formulation also affect absorption. Tablet and liquid dosage form. As compared to tablet, liquid dosage form easily absorb. So drug formulation first parameter is correct. Blood flow, absorption site. Higher the blood flow, higher the absorption rate. That is also affect absorption. And particle size, smaller the particle size, greater the surface area and greater the pharmacological actions. Means greater the absorption. So that is all of the above is the correct answer. Next question, first pass effect refers to. First pass metabolism, majorly questions asked in competitive examinations. So first pass metabolism means option A, the metabolism of drug in the liver before it reaches systemic circulation. B, the distribution of drug to all organs in the body. And C, the excretion of drug through the kidney. And D, none of this. So the excretion of drug through the kidney is that called excretion. Distribution of drug all organs in the body called as distribution. But question is that is first pass effect or first pass metabolism. So option A is the correct. The metabolism of drug in the liver before it reaches in systemic circulation. So you have to remember metabolism of drug in the liver before it reaches the systemic circulation. Hepatic enzyme that loses their activity. Metabolism is breakdown of drug. Next, enzyme induction refers to A, decrease in enzyme activity, B, increase in enzyme activity, C. The formation of drug metabolites, and D. Inhibition of drug metabolites. Enzyme induction means increased activity. Enzyme inhibition means decreases enzyme activity. So enzyme induction refers to the increase in enzyme activity. Next question, question number 15. Which of the following drugs is most likely to cause enzyme inhibition? Enzyme inhibition. So option A rifampin, B carbamazepine, C ketoconazole, and D phenobarbital. So option A is the enzyme inducer drug, B is the carbamazepine, also enzyme inducer drugs. Ketoconazole is the enzyme inhibitor drugs. Phenobarbital also enzyme inducer drugs. Sedative and hypnotics category. Phenobarbital, carbamazepine, phenothiazine, psychosis, it prevents the psychosis, and rifampicin is the anti-TB drug. You have to remember category also. Next, first order elimination kinetics. The rate of drug elimination is first order elimination kinetics. The rate of drug elimination is A. Constant regardless of drug concentration, B. Directly proportional to the drug concentration, and C. Independent of drug concentration, D. None of these. So B is the correct answer. Directly proportional to the drug concentration. Which increase the drug concentration, increase activity. Decrease the drug concentration, decrease activity. Next, which of the following is true about zero order elimination kinetics? A. The rate of elimination decreases, the drug concentration decreases. The rate of elimination is constant regardless of drug concentration. C. The half-life of drug decreases as the concentration decreases, and D. No any. So difference that B is the correct answer. The rate of elimination is constant regardless the drug concentration. Means when we increase the drug concentration, there is no effect on their actions. Means constant drug release rate of elimination is constant regardless of drug concentration. But in first order, directly proportional. Drug concentration increases, elimination also increases. So this is the all about MCQ in first unit. Next, branches and division of pharmacology. So pharmacology is the branch of science that deals with study of drug interaction with living system. The branches pharmacokinetics and pharmacodynamics. Pharmacokinetics deals with absorption, distribution, metabolism, and excretion. And pharmacodynamics deals with mode of actions and effect of drug, mechanism of actions and effect of drug. Clinical pharmacology deals with therapeutics effect. Toxicology deals with toxic. Posology deals with dose, and pharmacognosy deals with plants. Next, historical landmark of pharmacology. Hippocrates, father of medicine, work. The Hippocratic oath of modern day medicine reflect the high esteem with which this Greek physician is regarded. So this is the key summary of historical landmark. Hippocrates is the father of medicine. Next, Aristotle, father of biology. Next, Theophrastus. He utilized his teacher's scientific reasoning and applied to the plant kingdom. Next, Eberus Papyrus, first famous document regarding proved drugs. Galen is the first Greek pharmacist, physician, work who described many formulae containing plant and animal drugs. Paracelsus, an outstanding leader of Next, Virchow, the German physiologist. Pedanius Discorides, a Greek physician of the 1st century, Oswald Schmidberg, father of pharmacology, modern. He was first introduced concept of pharmacodynamics and pharmacokinetics of drug. Next, Sir Ramnath Chopra, father of Indian pharmacology. Next, Rudolf Buchmann, originator of experimental pharmacology. Paul Ehrlich developed a chemical theory and explained body immune response and important work in chemotherapy, coining the term magic bullet. Dhanvantri, also Ayurveda, traditional medicines. So these are the historical landmark of pharmacology. So Hippocrates is the father of medicine. Aristotle, father of biology. Galen, father of first pharmacist. Oswald Schmidberg, father of modern pharmacology. So this is the historical landmark of pharmacology. Next, nature and sources of drugs. Natural source, those drugs obtained from plant sources, animal sources, and plant. Many drugs are derived from plant sources, including morphine from opium poppy, quinine from cinchona tree, and aspirin from willow bark. Animals, some drugs come from animal products such as insulin from the pancreas of cows and heparin from intestine of pigs. Next, microorganism. Antibiotics like penicillin and tryptomycin are derived from fungi and bacteria. Synthetic sources. Drugs can be synthesized in laboratories using chemical reactions. Example including opioid like fentanyl or benzodiazepine like diazepam is used for sedative and hypnotic sleep producing drug, that is the diazepam. Next, biotechnological sources. Genetic engineering, modification of gene manipulation, or recombinant DNA technology. Genetic engineering techniques can produce drugs such as insulin, growth hormones, and monoclonal antibodies such as rituximab by inserting the genes from these proteins into microorganism. So this is the biotechnological source, means especially natural source, synthetic source, biotechnological source, etc. So this is the nature and sources of drugs. You have to remember this. Mnemonics, you have to remember. Pains, P means plant derived, example morphine from poppy, opium. A, animal derived, example insulin from cow pancreas. Inorganic or minerals, lithium, gold, salts, etc. Natural, penicillin from moles, Penicillium notatum and Penicillium chrysogenum, and yes, synthetic, paracetamol and sildenafil. This is the next. Essential drugs medicine concept means essential means आवश्यक ड्रग, गरजेचे ड्रग्स जे असणार आहेत ते म्हणजे इसेन्शियल ड्रग्स मेडिसिन. इसेन्शियल मेडिसिन आर दोज दॅट सॅटिस्फाय द प्रायोरिटी हेल्थ केअर नीड्स ऑफ पॉप्युलेशन. द हू हॅज डिफाइंड ॲज WHO, वर्ल्ड हेल्थ ऑर्गनायझेशन. Essential drugs medicines are those that satisfy priority healthcare needs of the population. Those that satisfy the priority healthcare needs of the population. They are selected with due regards to the public health relevance, evidence on efficacy, safety, and comparative cost effectiveness. Another, the price of individual and community can afford. जी कॉस्ट आहे ती सर्वसामान्यांना परवडणारी असली पाहिजे. अनदर, India produced National Essential Drug List 1996 and has revised it 2003 with the title of National List of Essential Medicine. Essential drug concept mnemonics, remember M. Mnemonics must have drugs, म्हणजेच essential drugs म्हणजे कसे असले पाहिजे, must be essential for treating the most common diseases. Another, used universally in healthcare system. Yes, safe and effective for use in wide range of conditions. T, timely availability, access. Have used to emphasize the need of drugs that meet public health needs, and drug selection is based on efficacy, safety, and affordability. Example essential drugs: famotidine, diazepam, allopurinol, amoxicillin, and clavonic acid. So famotidine is anti ulcer, prevent the acidity. Famotidine, ranitidine. Diazepam is a sedative and hypnotic category. Allopurinol is an antidote, is rheumatoid arthritis treatment. Amoxicillin and plus clavonic acid is antibiotic therapy. So this is the essential drug concept. Enzyme induction and enzyme inhibition. Enzyme induction means increase the activity of synthesis enzyme. Some drugs increase the activity of liver enzymes, speeding up the metabolism of other drugs. Example, rifampicin and phenobarbital. What happens when increase the activity of liver enzymes? Need to monitor drug level carefully as induction may decrease the therapeutic effect. जेव्हा ड्रग्स एन्झाईम इंडक्शन म्हणजे इन्क्रीज होतील सिंथेसिस, रिझल्ट काय होणार आहे, त्याची जी ॲक्शन आहे ड्रगची ती डिक्रीज होणार आहे. म्हणजे जर ॲक्शन ड्रगची डिक्रीज होत असेल तर ते मॉनिटर होणं गरजेचं आहे ड्रग लेवल. कारण एखादा डिसीज जर आपल्याला प्रिव्हेंट करायचा असेल तर त्याचा जो अमाऊंट ऑफ ड्रग आहे तो रीच झाला पाहिजे सिस्टमिक सर्क्युलेशन म्हणजे ब्लडमध्ये टू प्रिव्हेंट दॅट डिसीज. बट ड्रग मोर्स मेटाबोलाइज रिझल्ट इन डिक्रीज दिअर थेरापेटिक इफेक्ट. Next, enzyme inhibition, other hand, can reduce the metabolism of drug. Example, ketoconazole, leading to slower drug metabolism and possible toxicity. ड्रगचं जर मेटाबॉलिझमच झालं नाही तर रिझल्ट ड्रग कुठं राहणार ब्लडमध्ये, मग ब्लडचं कॉन्सन्ट्रेशन म्हणजे ड्रगचा इफेक्ट काय होईल, मोर ऑकस होईल. दॅट इज एन्झाईम इनिबिशन. एन्झाईम इंडक्शनमध्ये डिक्रीज द थेरापेटिक इफेक्ट, बट एन्झाईम इनिबिशन increase the drug effect. Inducing drug may cause therapeutic failure of co-administered drugs. Toxicity inhibition may lead to drug toxicity. Metabolism enzyme are slowed. So inducing drug may cause therapeutic failure, and toxicity inhibition may lead to drug toxicity. Metabolism enzyme are slowed. So you have to remember the difference enzyme inhibitions and enzyme induction. Kinetics of elimination: first order or zero order. You choose. First order kinetics, they depend upon concentration. Drug elimination is proportional to the drug concentration, means that the concentration of drug decreases, the rate of elimination decreases as well as. Example, aspirin, paracetamol, caffeine and diazepam, which follows first order kinetics. And zero order kinetics, drug elimination is constant. Alcohol, phenytoin, where the liver enzymes are saturated. Next, dose response relationship used to analyze a kind of response. Dose response relationship used to analyze a kind of response obtained after administering specific dose of drug. A wide range of drug doses can be easily displayed on a graph. Comparison between agonist and study of antagonism become easier. Drug plus receptor, drug receptor complex and pharmacological actions response. Combined effect of drugs. Two drugs simultaneous administration. Possible effect: decrease action of drugs, increase action of drugs, no interference with each other. When increase action of drug, that is agonist, and decrease action of drug, that is antagonist. Possible effect: combined effect of drugs. Sometimes we administer single drug, that time disease is not cured, but we administer multiple drug therapy also called. That times we prescribe the more than 2 drugs, 3 drugs. That's possible effect, that is increase action of drugs or decrease action of drug, combined effect of drugs. So this is a possible effect. Next, factor modifying effect of drugs. Posology. First year तुम्ही शिकला असाल posology मध्ये. It deals is the branch of medical science that deals with study of dose of drug, quantity. Drug should be administered in the dose that produce desired response without producing side effect. Means dose is a matter. Every drug is used as a medicine, but when it adjusting the dose. So factors: age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factors, idiosyncrasy, rate of elimination, synergism, antagonism, tolerance and tachyphylaxis. So first factor, age. We discuss age. Small child and old people require small dose as compared to adult. लहान मुलं जे आहेत आणि ओल्ड पीपल जे आहेत त्यांना डोस कमी लागतो ॲज कम्पेअर टू अडल्ट. Why this? Because small child and old people have improper work of organs. Small child does not develop organ properly or highly sensitive like kidney and liver. such as metabolism of liver and kidneys excretion. Similar like old people that have improper working of that organs. That's why small child and old people require small dose as compared to adult. In sex conditions, that is male and female. So in pregnancy conditions, special care is required. Some drug is cannot be administered in pregnancy conditions. That is the factors will affect. Body weight, higher the body weight, higher the dose is required. Lower the body weight, lower the drug is required. Dose. Approximately 70 kg is normal weight. Route of administration, oral route, parenteral route, topical route. So IV route have 100% bioavailability as compared to oral route. Time of administration, early morning before the administration of food. They have fastest actions. After lunch, they have decreased actions. So these are the factors affecting on. Next, pharmacokinetics. So pharmacokinetics means simply what the body does to the drug. What the body does to the drug. जे आपली बॉडी जी आहे त्या ड्रगसोबत काय करते किंवा डील्स विथ अब्झॉर्प्शन, डिस्ट्रीब्युशन, मेटाबॉलिझम आणि एक्सक्रेशन. आणि फार्माकोडायनॅमिक्स म्हणजे काय, व्हॉट द ड्रग डज टू द बॉडी. ड्रगचा इफेक्ट काय आहे बॉडी, मोड ऑफ ॲक्शन्स म्हणजेच फार्माकोडायनॅमिक्स. हॅव डिफरन्शिएट फार्माकोकायनेटिक्स अँड फार्माकोडायनॅमिक्स. फार्माकोकायनेटिक्स मीन्स what the body does to the drugs, and pharmacodynamics what the drug does to the body. So pharmacodynamics also some of the drug produce their mode of action by binding to the enzyme or ion channel. So pharmacokinetics, absorption, first factor that is absorption. Absorption means movement of drug from site of administration to systemic circulation. इसेन्शियल प्रॉपर्टी जर रिक्वायर्ड अब्झॉर्प्शनला म्हणलं तर लेस पार्टिकल साईज, म्हणजे पार्टिकल साईज जर स्मॉलर असेल तर ग्रेटर सरफेस एरिया असेल आणि ग्रेटर अब्झॉर्प्शन असेल. अनदर मोर सरफेस एरिया, लिपिड सोल्युबिलिटी, जर लिपिड सोल्युबल असेल तर मोर अब्झॉर्प्शन असेल. अनदर अनआयोनाइज्ड फॉर्म असेल तर मोर अब्झॉर्प्शन असेल. सो दॅट इज द अब्झॉर्प्शन. नेक्स्ट डिस्ट्रीब्युशन. Distribute, first absorb drug, then distribute to the blood, ferrous tissue. Proteins, blood contain 55% plasma and 45% cell. So plasma it contain proteins. So drug have distributed into proteins. So proteins have three types of protein. Albumin, most of acidic drug bind. Alpha acidic glycoproteins, most of basic drug bind. And globulin, some of the acidic or basic drug bind. So after second that is distribution. Third metabolism. किंवा मेटाबॉलिझमलाच आपण बायोट्रान्सफॉर्मेशन पण म्हणू शकतो की मेटाबॉलिझम इज अ कन्वर्जन ऑफ is a process in which drugs are changed from one form to another form with the help of enzyme. Conversion of drug. So after metabolism, drug have to metabolize means inactive drugs, but only prodrugs have after metabolism they have to active in the form. Liver is the essential of hepatic enzyme. किंवा मेटाबॉलिझम होणे म्हणजेच कॉल्ड डिटॉक्सिफिकेशन ऑफ ड्रग. मेजर साइट फॉर मेटाबॉलिझम इन लिव्हर एन्झाईम इज दॅट कॉल्ड सायटोक्रोम P450. मेजर एन्झाईम जो रिस्पॉन्सिबल आहे तो सायटोक्रोम P450. मेटाबॉलिक रिॲक्शन, टू रिॲक्शन्स आहेत, फेज 1 रिॲक्शन आणि फेज 2 रिॲक्शन. फेज 1 मध्ये ऑक्सिडेशन, रिडक्शन, हायड्रोलायसिस, आणि फेज 2 मध्ये कॉन्जुगेशन. And next last one, that is excretion. Excretion is an irreversible process. It can excrete the drug elimination. So this is the pharmacokinetics. So here is unit 1 is over. Next we turn to the unit 2. In that syllabus, that is principle and mechanism of drug actions, receptor theories, classification of receptor, regulations, introduction to transmembrane, other drug reactions, addictions, drug interactions, introduction to drug discovery, preclinical evaluations and clinical trials, introduction to pharmacology. So these are the syllabus. Next turn to the multiple choice questions. Which of the following is not a mechanism of drug action? First, A. Drug receptor interactions, B. Inhibition of ion channels, C. Gene expression modulation. Not mechanism of drug action, none of the above. There is not given, means drug receptor interaction is also mechanism of drug actions. Inhibition of ion channels, these are also drug actions. Gene expression modulations also. But the D is, means none of the above, means that is not correct answer. Means D is other drug receptor interaction is correct, inhibition of ion channel is correct, C. Gene expression modulation is correct, but D is none of the above. That means that answer is wrong. Next, the binding of drug, which of the following receptor primarily result in opening or closing of ion channel? A. G protein coupled receptor, B. Ion channel modulation, C. Tyrosine kinase receptor, and D. Nuclear receptor. Ion channel receptor, ion channel modulation. Next, which of the following true about G protein coupled receptor, GPCRS? A. 7 transmembrane domains, B. is a large family of cell surface receptor that mediate variety of physiological response. Another, GPCR categorized based on their ligand structure and gene proteins. Adrenergic receptor, dopamine receptor, serotonin receptor, muscarinic acetylcholine, opioid receptor, and D, all of the above. So D is the all of the above is the correct answer. So G protein coupled receptor, adrenergic receptor, dopaminergic receptor, serotonic, muscarinic. So this is the largest class of receptor. So muscarinic receptor in that M1, M2, M3, M4, M5. M1 is located parietal cell, M2 located heart, M3 gland, smooth muscle, M4 CNS, mild CNS depressant activity, M5 CNS. Next, the receptor theory, relationship between the dose of drug and the intensity of effect is described by which of the following? Dose response curve. Next, spare receptor refers to A. Spare receptor are characteristics of certain signaling system where the maximum response is achieved without full receptor is occupancy. B. Spare receptor refers to the phenomena where not all receptors need to be occupied by ligand or order to produce full cellular response. In other words, submaximal number of receptors can be activated to achieve the maximum biological effect. C. Muscarinic receptor, smooth muscle contraction system, smooth muscle achieve maximal muscle contractions, and D, all of the above. So answer is correct. D is the all of the above. Means spare receptor are those which provide maximum response is achieved without full receptor occupancy, means occupy. Dose response curve means question that the receptor theory relationship between dose of drug and the intensity of effect is described by which of the following? That is dose response curve. Why this? Emax theory is related to dose response curve, but the special refers to the maximum effect of drugs can produce Emax dose increases. Therapeutic index, this refers to the range of drug doses that produce desired effect without causing significant adverse effect. Half-life theory, this concept time take for the concentration of drug to bloodstream to reduce by half, not to the relationship between dose and effect. Tachyphylaxis. Next question, that is Tachyphylaxis, A option, a drug increasing effectiveness after repeated administration. B, tachyphylaxis is rapid decrease in the response of drug after its administration, often occurring or after repeated dose over a short period of time. C, hypersensitivity reaction. D, the adaptation of body to the drug. So tachyphylaxis means is a rapid decrease in the response to the drug after its administration, occurring after repeated dose over the short period of time. So B is the correct answer. Next, which of the following is the example of drug dependence or addictions? Option A, withdrawal symptoms upon the cessation of drug use. B, reduction of the drug effect over time. C, development of an allergy to the drug. D, sudden exaggerated response to the drug. So sudden exaggerated response of drug means allergy. Development of allergic to the drugs, reduction of drug effect over time. So A is the correct answer. Withdrawal symptoms. Drug dependence means when we stop the uses of that drugs result in withdrawal symptoms upon the cessation of drug uses. Another and next questions, an allergic reactions. Question number 8. An allergic reaction. Drug involves which immune system components? T cell, beta cell, Ig antibodies, and D complement system. Allergic reactions, that is Ig antibodies. C is the correct answer. Ig antibodies which cause allergic reaction. Drug involves immune system components. It causes hypersensitive reactions also, you have to remember. Type 1, type 2, type 3 and type 4 hypersensitive reactions. Idiosyncrasy refers to A, a rare unpredictable reaction to the drug that is not dose dependent. B, a type of allergy that develops with time. C, pharmacokinetics interactions. And D, an unexpected side effect of drug. So idiosyncrasy is the correct answer. A rare and unpredictable reaction to the drug that is not dose dependent. Next, pharmacokinetic drug interactions involve A, alteration in the pharmacological effect of drug. B, change in absorption, distribution, metabolism or excretion of drug. C, change in receptor binding. And D, interference with drug receptor binding. So pharmacokinetics means आपण काय सांगितलं की pharmacokinetics means study of absorption, distribution, metabolism and excretion. म्हणजे इंटरॅक्शन म्हणजे काय होणार आहे, जेव्हा दोन ड्रग्स ॲडमिनिस्टर करणार आहेत आयदर ड्रग्स ॲक्शन इन्क्रीज होणार आहे किंवा डिक्रीज होणार आहे ड्रग इंटरॅक्शन. सो बी इज द करेक्ट आन्सर. चेंजेस इन absorption, distribution, metabolism or excretion of drug. Next, which of the following interaction is an example of pharmacodynamic drug interaction? A, one drug inhibits the metabolism of another drugs. B, a drug component with another drug for renal excretion. C, two drugs produce additive effect when taken together. D, a drug increases the half-life of another drug by altering its absorption. C is the correct answer. Two drugs produce additive effect when taken together. Next, preclinical evaluation of new drug primarily involves A, testing in preclinical and clinical. Preclinical means study of animals. A, testing in human volunteers. B, laboratory studies in animal models. C, phase 4 clinical trials, that is post-marketing surveillance. D, evaluation of side effect in humans. So B is the correct answer. Preclinical evaluation means new drugs means laboratory studies in animal models. Next, which phase of clinical trials focus on the safety and doses of new drug in healthy volunteers? Phase 1, phase 2, phase 3 and phase 4 and phase 0, that is microdosing. Question is that which phases of clinical trials focus on safety and doses of new drug in healthy volunteers? Phase 1, phase 2, phase 3 and phase 4. So first upon drug discovery. Drug discovery, in that target selection, lead finding, lead optimization and pharmacological profiling. 2 to 5 years is required. Second step, that is preclinical development, pharmacokinetics, short-term toxicity, formulations, synthetic scale-up. 1 to 5 years required. Third, clinical development. So phase one in that pharmacokinetics, side effect, healthy volunteers carried out. So phase one in that carried out safety of dosage form, that is A is the correct answer. So also remember phase one, that is safety of dosage form is carried out. Phase two in that efficacy and safety will carried out near about 20 to 200. आणि फेज वनमध्ये हेल्दी व्हॉलंटियर्स क्वेश्चन याच्यावर विचारला आहे की कोणते व्हॉलंटियर्स युटिलाइज केले जातात. हेल्दी व्हॉलंटियर इज यूज इन फेज वन. फेज टूमध्ये लॉंग टर्म टॉक्सिसिटी कॅरीड आउट केली जाते 20 to 200 पेशंट. नेक्स्ट लार्ज स्केल 100 to 1000. And post marketing surveillance phase 4, that is also called as phase post marketing surveillance. Next, pharmacovigilance refers to study of drug pharmacokinetics. B, the process of monitoring and detecting adverse effect of drug. C, clinical trials conducted to the establish drug effect. And D, development of new drug. So development of new drug means that is drug discovery. In that drug discovery required drug discovery, target selection, lead finding, lead optimization, pharmacological profiling, preclinical development means study of animal, clinical development, phase 1, phase 2, phase 3 and phase 4. Another, before the new drug in market tested in animal and investigational new drug applications. Phase 3 मध्ये new drug is found safe and effective, application filed with FDA, new drug application NDA to the market. And phase 0, that is microdosing. So pharmacovigilance is not a development of new drug. Study of drug in pharmacokinetics, that is also not, but B is the correct answer, monitoring and detecting adverse effect of drug, that is the pharmacovigilance refers. So phase 1 clinical trials focus on safety of doses from new drug. Healthy volunteers used. Remember that is healthy volunteer. Drug safety. And in phase 2 focus evaluating drug effectiveness, further assessing safety larger group participant near about 20 to 200. And phase 3, these trials involve larger group patients and aim to confirm the drug effectiveness, monitor the side effect and compare it to existing. And D, phase 4, that is phase occurs, drug has been approved and marketed. It involves post-market surveillance to monitor the drug's long-term effect and effectiveness in general populations. Mnemonics. Allergy. A receptor, there have 4 types of receptor: G protein receptor, nuclear receptor, enzymatic receptor and ion channel receptor. Types adverse reaction, you have to remember. And tolerant idiosyncrasy, do things. And E means allergy, T means tolerance, idiosyncrasy means idiosyncrasy, D means dependence and T means tachyphylaxis. And for phase of clinical trials, investigate every large milestone. E means one phase means that is इनिशियल सेफ्टी. फर्स्टला काय बघणार आपण, सेफ्टी बघणार आहेत. सेकंडला इफिकसी, किती सेफ आहे इफिकसी किंवा किती त्याची ॲक्टिव्हिटी आहे. फेज 2. फेज 3 मध्ये लार्ज स्केल टेस्टिंग बघणार आहेत सेफ्टी. आणि फेजमध्ये पोस्ट मार्केटिंग सर्व्हिलन्स. सो receptor is defined as a macromolecules or binding site located on the surface or inside the effector cell that serve to recognize signal molecule or drug and initiate the response to it, but itself has no other function. So receptor are macromolecules proteins in nature. Another receptor are receiving proteins. And another nature is receptor, that is protein, as it acts as a specific binding site for drug molecule. Another, all receptor are protein in nature, but all proteins are not receptor. You have to remember also. All receptor are proteins in nature, but all proteins are not a receptor. So ligand, Ligand means what is it? Is a molecule that can selectively attaches to the receptor and activate the receptor and produce maximum pharmacological action. Ligand is a molecule that can selectively attaches to the receptor and activate the receptor and produce maximum pharmacological activities. Cholinergic, adrenergic, histaminic, dopamine. Next, affinity. Affinity, capacity of agent to bind with a receptor. Intersonic activity, efficacy, capacity of an agent to activate the receptor and produce the pharmacological action. Agonist, capacity to bind and show pharmacological action. Maximum intersonic activity. Receptor occupancy theory, drug receptor complex. Classification of receptor, G protein coupled receptor, ligand gated ion channel receptor, enzymatic receptor, and nuclear receptor. So G protein coupled receptor first, that is 7. You have to remember characteristics. 7 membrane receptor. Pathways of G protein coupled receptor, that is adenyl cyclase pathways, phospholipase pathways, so G protein coupled receptor, in that is the largest class of receptor. Why is largest class? Because it comes under various receptor: muscarinic receptor, adrenergic receptor, histaminic receptor, dopaminic receptor, opioid receptor. Opioid means mu, kappa, and delta, morphine binding site, endorphin, enalpine, etc. So muscarinic receptor, in that parasympathomimetic drugs, muscarinic receptor. Muscarinic receptor, in that M1, M2, M3, M4, M5. M1 means it located on parietal cell. M2 it located from heart. M3 smooth muscle. M4 CNS. M5 also CNS. You have to remember this. This is the very important location of muscarinic receptor. M1, M2, M3, M4, 5. And adrenergic receptor, sympathomimetic. Pharmacological actions: alpha 1 it located blood vessel, alpha 2 CNS, beta 1 heart, beta 2 smooth muscle, beta 3 adipose tissue. This is also important. Alpha 1 blood vessel, alpha 2 CNS, beta 1 heart, beta 2 smooth muscle, beta 3 adipose tissue. Next, ligand gated or ion channel receptor. This is the fastest action. This receptor also called as transcellular receptor. When the ligand bind to the receptor, an opening of ion channel take a place, that result is faster. And inotropic receptor, in that 5-HT3, GABA A, benzodiazepine binding site, nicotinic receptor, and NMDA receptor. Next, enzymatic receptor. This receptor are coupled to the enzyme. This is also transcellular. When ligand bind to the receptor, an enzyme undergoes phosphorylation, which is responsible for mediating the pharmacological action. Example: insulin receptor, tyrosine kinase, and nuclear receptor. Receptor are coupled to the nucleus. Intracellular. All are the transcellular, but nuclear receptor is a intracellular. This is the slowest receptor, means actions. Example: steroid hormone, vitamin D, very slowest acting. Cytoplasmic receptor. So these are the receptor you have to remember. Receptor are specific protein that are drug bind to the initiating response, GPCRS. Signal transduction mechanism, pathways through which receptor communicate intracellularly or trigger physiological effect. Cyclic AMP signaling in the response to adrenergic receptor activation. Ion channel receptor, this is the fastest receptor, millisecond or microsecond it can give the action. Directly control ion channels to the ultracellular activity, nicotinic acetylcholine receptor, or it is also called as inotropic receptor. GPCRS involves signal transduction, beta adrenergic receptor, heart rate modulation by adrenaline, enzymatic receptor, receptors that are coupled with intracellular enzymes involved in activating signal, insulin receptor, activate tyrosine kinase signaling, JAK-STAT receptor, cytokinin receptor that activate the JAK-STAT pathways to regulate gene transcription. Spear receptor, it shows the submaximal effect without occupies full receptor. Not all receptors are required for maximum heart rate response. So adverse drug reaction means any abnormal response of drug. Adverse effect is undesirable or unintended consequence of drug administration. It is a broad term include all kinds of noxious effect, serious or even fatal. Any noxious change which is suspected to be due to the drug dose normally used in man. जे आपण कधी कधी ड्रग घेतलेला आहे आणि त्याचा ड्रगचा जो इफेक्ट आहे टू क्युअर द डिसीज बट तो डिसीज नाही क्युअर होता एक दुसराच इफेक्ट दाखवतोय जो की बेनिफिशियल नाही आहे बॉडीसाठी. दॅट इज मीन्स ॲडवर्स ड्रग रिॲक्शन. Any abnormal response of drug may require treatment or decrease in the dose or cautions in it be the future use of same drug. म्हणजे adverse drug reaction जर प्रिव्हेंट करायचं असेल तर काय करावं लागेल, डिक्रीज द डोस, अनदर प्रिकॉशन्स घ्यावं लागेल फॉर फ्युचर यूज ऑफ ड्रग, किंवा मग डॉक्टरला त्याची जी इफेक्ट आहे तो सांगावा लागेल. क्लासिफिकेशन ऑफ adverse drug reaction: A. Augmented, B. Desire, C. Continuous, D. Delayed, and E. Ending use, and F. Failure of efficacy. Type A. Predictable based on pharmacological properties, and B. Type B. Non-predictable based on immunological response and genetic makeup of person. म्हणजे टाईप ए प्रिडिक्टेबल करू शकतो आपण की कशामुळं हा साईड इफेक्ट किंवा ॲडवर्स ड्रग रिॲक्शन दाखवा झालेला आहे. टाईप बी नॉन प्रिडिक्टेबल. Addiction, the physical and psychological dependence on drug, opioids, or heroin or morphine, it causes adverse drug reactions. Tolerance, decrease the drug effectiveness with prolonged use. Alcohol, need for higher dose to achieve same effect due to the tolerance. Dependence, physical or psychological reliance on the substance, benzodiazepine, sedative and hypnotic category. Tachyphylaxis, rapid loss of drug effect after repeated administration. Nitroglycerin used in treatment of angina pectoris, such as demand and supply of oxygen in angina pectoris. Chest pain is a sign. Idiosyncrasy, unpredictable genetically influenced drug reactions. Isoniazid causes liver toxicity in some individual. Allergy, immunomediated reactions to the drug किंवा hypersensitivity म्हणतो आपण त्याला. Penicillin can cause anaphylaxis in allergic individual. Drug interactions, म्हणजेच इफेक्ट ऑफ वन ड्रग अल्टरिंग द ॲक्टिव्हिटी ऑफ अनदर, म्हणजे सायमल्टेनियस ट्रान्समिशन ऑफ टू ड्रग, वन ड्रग अल्टर द ॲक्टिव्हिटी ऑफ अनदर ड्रग्स, दॅट इज कॉल्ड ड्रग इंटरॅक्शन. ड्रग इंटरॅक्शन मीन्स वेन सायमल्टेनियस ट्रान्समिशन ऑफ टू ड्रग, वन ड्रग अल्टर द ॲक्टिव्हिटी ऑफ अनदर ड्रग. फार्माकोकायनेटिक्स इंटरॅक्शन, अल्टरेशन ऑफ ड्रग अब्झॉर्प्शन, डिस्ट्रीब्युशन, मेटाबॉलिझम और एक्सक्रेशन. Cytochrome P450 enzyme is interactions. Grapefruit juice inhibit cytochrome P3A4 affecting statins. Pharmacodynamic interactions, interaction at the site of drug action altering the drug effect. Beta blocker and calcium channel blocker, additive heart rate lowering effect. ड्रग इंटरॅक्शन म्हणजेच काय, इंटरॅक्शन्स, दोन ड्रग्सचे इंटरॅक्शन्स होणार म्हणजे ॲक्शन त्याची अल्टर होणार म्हणजे आयदर इन्क्रीज और डिक्रीज. फार्माकोकायनेटिक इंटरॅक्शन म्हणजेच अब्झॉर्प्शन, डिस्ट्रीब्युशन, मेटाबॉलिझम आणि एक्सक्रिशन इंटरॅक्ट होणे, म्हणजे अब्झॉर्प्शन इन्क्रीज होणे किंवा डिक्रीज होणे. एक्झाम्पल टेट्रासायक्लिन आणि मिल्क जर सोबत ॲडमिनिस्टर केलं ड्रग टेट्रासायक्लिन इज अँटीबायोटिक्स विथ मिल्क जर सोबत ॲडमिनिस्टर केलं तर रिझल्ट इन बोन डिफेक्ट, चिलेशन किंवा डिक्रीज द अब्झॉर्प्शन ऑफ टेट्रासायक्लिन. जर अब्झॉर्प्शन टेट्रासायक्लिनचं जर डिक्रीज झालं तर रिझल्ट काय होणार आहे, जी अँटीबायोटिक ॲक्टिव्हिटी शो व्हायची ती ॲक्टिव्हिटी शो होणार नाही. दॅट इज अ फार्माकोकायनेटिक्स इंटरॅक्शन्स. फार्माकोडायनॅमिक इंटरॅक्शन्स, इंटरॅक्शन ॲट द साइट of drug action. But how to reduce drug interactions? Identify the patient risk factor, take through the drug history, be knowledgeable about the actions of drug being used. Another, consider the therapeutic alternative, avoid complex therapeutic regimen when possible, educate the patient, monitor the therapy and patient counseling. This is the reducing the risk of drug interactions. And last one, that is in second unit, introduction to pharmacovigilance. Pharmacovigilance is a science of activities relating to detection, assessment and understanding and prevention of adverse effect or any other drug related problems is known as pharmacovigilance. So pharmacovigilance means study of adverse drug reactions. Pharmacovigilance programs of India, PVPI, is an Indian government organization which identify and respond to the drug safety problems. Its activity include receiving the report of adverse drug event and taking necessary action to the remedy problems. फार्माकोविजिलन्स काय, जे ड्रगचे ॲडव्हर्स इफेक्ट येतात, जे की ड्रग आपण ॲडमिनिस्टर करतो टू क्युअर द डिसीज, टू क्युअर द डिसऑर्डर्स, बट ड्रग विट कॉज द ॲडव्हर्स ड्रग रिॲक्शन. दॅट डिटेक्शन, दॅट इज द ब्रांच विल डिटेक्ट detection, assessment and understanding and prevention of adverse effect or any other drug related problem, that is called as pharmacovigilance. It has important role in rational use of medicine as it is provide basis for assessing safety of medicine. Next, turn to the unit number 3rd, that is pharmacology of drug on peripheral nervous system. So nervous system have two types, central nervous system and peripheral nervous system. Central nervous system have again two categories, brain and spinal cord, and peripheral nervous system, cranial nerve and spinal nerve. Another, somatic nervous system, autonomic nervous system. So nervous system have functions to control body parts. In this syllabus, that is introduction to autonomic nervous system, parasympathomimetics, parasympatholytics, sympathomimetics, sympatholytics. The confusing terms are parasympathomimetics means increased activity of parasympathetic nervous system. You have to remember. Mimetics means increase. Parasympatholytics means block the activity of parasympathetic nervous system. And sympathomimetics means increase the sympathetic nervous system activity. And sympatholytics means block the activity of sympathetic nervous system. Neuromuscular blocking agents, skeletal muscle relaxant, local anesthetics means लोकल म्हणजे पर्टिक्युलर साईडला जो ड्रग दिला जातो, दॅट इज लोकल अनास्थेटिक्स. टू मायनस सर्जरी किंवा ऑपरेशन असेल त्या कंडिशनमध्ये लोकल अनास्थेटिक्स एजंट युटिलाइज केले जातात. ड्रग युज्ड इन मायस्थेनिया ग्रॅव्हिस अँड ग्लॉकोमा. ग्लॉकोमा इज इंट्राक्युलर टेन्शन, जे आय डिसऑर्डर आहे. ह्याच्यामध्ये क्वेश्चन्स कोणते कोणते विचारले आहेत. क्वेश्चन नंबर 1, पहिला क्वेश्चन आहे, विच ऑफ द फॉलोइंग इज द कॅरेक्टरिस्टिक्स ऑफ पॅरासिम्पॅथोमायमेटिक ड्रग्स. तर पॅरासिम्पॅथोमायमेटिक ड्रग्स काय सांगितले, दे इनिबिट द ॲसिटिलकोलिन रिलीज. बी, दे मिमिक द ॲक्शन ऑफ पॅरासिम्पॅथेटिक नर्वस सिस्टीम. सी, दे इन्क्रीज द हार्ट रेट. अँड डी, दे इनिबिट द ॲसिटिलकोलिन इस्टेज ॲक्टिव्हिटी. आता पॅरासिम्पॅथोमायमेटिक ड्रग काय सांगितलं आपण, की इन्क्रीज द ॲक्टिव्हिटी ऑफ पॅरासिम्पॅथेटिक नर्वस सिस्टीम. कुठं दिसतंय का, द मिमिक द ॲक्शन ऑफ पॅरासिम्पॅथेटिक नर्वस सिस्टीम, म्हणजे बी आन्सर हे करेक्ट आहे. नेक्स्ट काय सांगितलं, विच ऑफ द फॉलोइंग ड्रग इज द एक्झाम्पल ऑफ पॅरासिम्पॅथोलायटिक एजंट. आता ऑप्शन ए काय सांगितलं, ॲट्रोपिन. ऑप्शन बी फायस्टिगमिन. सी, पिलोकार्पिन. अँड डी, बेथॅनोकोल. सो पॅरासिम्पॅथोलायटिक इज द करेक्ट आन्सर. ॲट्रोपिन इज द पॅरासिम्पॅथोलायटिक ड्रग, म्हणजे ते ब्लॉक द ॲक्टिव्हिटी ऑफ पॅरासिम्पॅथेटिक नर्वस सिस्टीम. म्हणजे सिम्पॅथेटिक नर्वस सिस्टीम जर ॲक्टिवेट झाली बॉडीमध्ये तर ते काय करणार आहे, हार्ट रेट डिक्रीज असणार आहे. तर त्याच्यामुळे इथं ॲट्रोपिनचं ॲडमिनिस्टर केलं तर काय होईल, हार्ट रेट इन्क्रीज करणार आहे. म्हणजे ब्रॅडिकार्डिया जर कंडिशन सफर होत असेल तरी काय करणार, टॅकिकार्डिया कॉज. नेक्स्ट, विच क्लास ऑफ ड्रग इज यूज्ड इन द ट्रीट ऑफ हायपरटेन्शन बाय इनिबिटिंग द सिम्पॅथेटिक नर्वस सिस्टीम. लायटिक काय सांगितलं, विच क्लास ड्रग यूज टू ट्रीट हायपरटेन्शन बाय इनिबिटिंग द सिम्पॅथेटिक नर्वस सिस्टीम, म्हणजे सिम्पॅथोलायटिक. जर सिम्पॅथोमायमेटिक म्हणजे स्टिम्युलेट जर म्हणलं असतं तर सिम्पॅथेटिक नर्वस सिस्टीम, तर दॅट इज सिम्पॅथोमायमेटिक. बट इथं काय म्हणलं, इनिबिटिंग म्हणजेच ब्लॉकिंग किंवा प्रिव्हेंटिंग द सिम्पॅथेटिक नर्वस सिस्टीम, दॅट इज सिम्पॅथोलायटिक्स. नेक्स्ट, व्हॉट इज द प्रायमरी ॲक्शन ऑफ न्यूरोमस्क्युलर ब्लॉकिंग एजंट? ए. स्टिम्युलेटिंग skeletal muscle contraction. B. Inhibiting acetylcholine release at the neuromuscular junction. C. Blocking muscarinic receptor in the brain. And D. Blocking the nicotinic receptor at the neuromuscular junction. Blocking the nicotinic receptor at the neuromuscular junction. Next, which drug is commonly used to reverse the effect of neuromuscular blockade? A. Atropine. B. Neostigmine. C. Physostigmine. And D. Propranolol. Neostigmine. न्यूरोमस्क्युलर, आता अट्रोपिन काय पॅरासिम्पॅथो लायटिक ड्रग आहे, फायस्टिकमिन पॅरासिम्पॅथो मायमॅटिक ड्रग आहे, प्रोपेनॉल काय सिम्पॅथोलायटिक ड्रग्ज आहेत. तर तुम्हाला कॅटेगरी माहिती असणं गरजेचं आहे. के.डी. त्रिपाठीचं क्लासिफिकेशनचं बुक जर तुम्ही बघितलं, इच अँड एव्हरी ड्रग हॅव गिवन द कॅटेगरीज ऑफ ड्रग. नेक्स्ट, विच ऑफ द फॉलोइंग लोकल अनेस्थेटिक्स हॅज द लॉंगेस्ट ड्युरेशन ऑफ ॲक्शन? ए. लिडोकेन. बी. प्रोकेन. सी. बुफेवाकेन. अँड डी. कोकेन. Bupivacaine. Next, which of the following is the mechanism of action of local anesthetics? A. Blockage of sodium channels. B. Blockage of potassium channels. C. Blockage of calcium channels. And D. Inhibition of acetylcholine release. Blockage of sodium channel. Next, which of the following drug is used in the treatment of myasthenia gravis? Pyridostigmine. Which drug is used in treatment of glaucoma by reducing intraocular pressure? Timolol. So these are the drug. Multiple choice questions. Summary: parasympathomimetics, the cholinergic agonist, also called, mimic the acetylcholine actions on the muscarinic receptor. Example कोणते parasympathomimetics चे? Pilocarpine आहे. Pilocarpine is also used in treatment of glaucoma. Neostigmine, physostigmine, it causes bradycardia, increased GI motility, gastrointestinal motility, pupil constriction, bronchoconstriction, and ही जर सिस्टीम जर ॲक्टिवेट राहिली, मिमिक द ॲक्टिव्हिटी ॲसिटिलकोलिन किंवा पॅरासिम्पॅथेटिक नर्वस सिस्टीम, तर ग्लोकोमा कसं होऊ शकेल? मायस्थेनिया ग्रॅव्हिस, अल्झायमर, युरिनरी रिटेन्शन, स्वेटनिंग, सलायवेशन्स आणि हायपोटेन्शन अँड डायरिया हे कंडिशन्स पॅरासिम्पॅथोमायमेटिक्स मिमिक ॲक्टिव्ह झाले. मग तीच ब्लॉक करायची असेल तर आपलं पॅरासिम्पॅथोलायटिक्स अँटीकोलिनर्जिक एजंट, ब्लॉक द ॲसिटिलकोलिन रिसेप्टर, मस्कॅरिनिक, ॲट्रोपिन, स्कोपोलामाइन, टॅकिकार्डिया. ह्याचे साईड इफेक्ट काय? टॅकिकार्डिया, ड्राय माउथ, कॉन्स्टिपेशन, युरिनरी रिटेन्शन, पपिल डायलेशन, प्री ॲनेस्थेटिक, मोशन सिकनेस, COPD, coronary obstructive pulmonary disorder, blood vision, dry mouth. So this will discussing summary of drug acting on peripheral nervous system. Sympathomimetics, adrenergic agonists stimulate the adrenergic receptor alpha and beta. Epinephrine, example that is non-epinephrine. Phenylephrine, albuterol. Sympatholytics, the drug which block the activity of sympathetic nervous system. Example कोणते ह्याच्यामध्ये? प्रोपेनॉल, अँटीहायपरटेन्सिव्ह ड्रग्स, प्राझोसिन, टेरोझोसिन्स, अल्फा 1 ब्लॉकर, अटेनॉलॉल. So this drug will decrease the blood pressure, vasodilatations. Next, neuromuscular blocking agent. This block the transmission at neuromuscular junctions. Example: atracurium, vecurium, succinylcholine. Local anesthetic agent. Local anesthetics agent कशासाठी यूटिलाइज करतो? लोकल anesthetics, the agent used for minor surgery, block the sodium channel and prevent nerve impulse conduction. Example कोणते ह्याच्यामध्ये? लिडोकेन, बुफेवाकेन, प्रोकेन. अनाल्जेसिया, लॉस ऑफ सेन्सेशन विदाउट लॉस ऑफ कॉन्शियसनेस. मायनर सर्जरीमध्ये आपण हे ड्रग्स यूटिलाइज करतो, किंवा डेंटल प्रोसिजर, याच्यामध्ये CNS टॉक्सिसिटी किंवा कार्डिओव्हास्क्युलर डिप्रेशन आणि अलर्जिक रिॲक्शन्स ऑकर्स होऊ शकतात. नेक्स्ट, ड्रग्स फॉर मायस्थेनिया ग्रॅव्हिस inhibit the acetylcholine esterase, increase the acetylcholine at neuromuscular junction. Example कोणते ड्रग्स आहेत? निओस्टिग्मिन यूज केलं जातं मायस्थेनिया ग्रॅव्हिस. इज अ ऑटोइम्युनो डिसऑर्डर्स. पायरोस्टिग्मिन इम्प्रूव्ह द मसल स्ट्रेंथ. मायस्थेनिया ग्रॅव्हिस विकनेस आणि सिम्पटम्स याच्यामध्ये काय आहेत, विकनेस ऑकर्स होतं, एक्सेसिव्ह सलायव्हेशन्स, डायरिया, मसल विकनेस हे प्रॉब्लेम्स होऊ शकतात. नेक्स्ट ड्रग्स फॉर ग्लॉकोमा डिक्रीज द इंट्राक्युलर प्रेशर्स बाय इन्क्रीजिंग द ॲक्वियस ह्युमर ड्रेनेज और रिडक्शन प्रोडक्शन. ड्रग्स कोणते ग्लॉकोमा ट्रीट करण्यासाठी, पिलोकार्पिन, टिमोलॉल, रिड्यूस इंट्राक्युलर प्रेशर. So these are the neuromuscular blocking agent. Example local anesthetics. Example as well as drugs for myasthenia gravis. Inhibit acetylcholinesterase, increase acetylcholine at neuromuscular junction. Next we will turn to the unit 4, pharmacology of drug acting on central nervous system. So nervous system have two types, central nervous system and peripheral nervous system. We discuss about peripheral nervous system. Now we will discuss about drug acting on central nervous system. Neurohumoral transmissions means neurotransmitters. Special emphasis is given on importance of various neurotransmitter like GABA, gamma aminobutyric acid, glutamate, glycine, serotonin and dopamine. Excitatory neurotransmitters acetylcholine असेल, serotonin असेल, नॉन इपिनेफ्रिन असेल, इनिबिटरी न्यूरोट्रान्समीटर गॅमा अमायनोब्युटरिक ॲसिड असेल, ग्लायसिन असेल अँड डोपामाइन. अनदर काय सांगितलं, जनरल अनास्थेटिक्स अँड प्री अनास्थेटिक्स. प्री अनास्थेटिक्स कशाला म्हणतो, बिफोर द अनास्थेशिया. सिडेटिव्ह अँड हिप्नॉटिक्स, सेंट्रल ॲक्टिंग मसल रिलॅक्संट, अँटीइपिलेप्टिक, अल्कोहोल अँड डायसल्फिराम. दिस आर द युनिट 4 सिलेबस. आता न्यूरोट्रान्समीटर आपण कोणते सांगितलेले आहेत, डोपामाइन. आता डोपामाइनचा रोल काय आहे, तर डोपामाइनची लेवल जर डिक्रीज झाली तर पार्किन्सोनिझम डिसीज ऑकर्स होतो आणि इन्क्रीज जर झाली तर सिझोप्रेनिया. मूवमेंट जी आपल्या बॉडीची मूवमेंट आहे ती ड्यू टू द डोपामाइन किंवा अनदर डोपामाइनचा रोल जो आहे त्या रिवॉर्ड अँड अवॉर्ड सिस्टीम. ॲसिटिलकोलिन अल्झायमर, जर डिक्रीज ॲसिटिलकोलिन लीड्स टू कॉज अल्झायमर, मेमरी. गॅमा अमायनोब्युटरिक ॲसिड, epilepsy disease, insomnia. Glutamate, migraine and stroke. Endorphin, anxiety and opioid. Serotonin जो डिप्रेशन प्रिव्हेंट करण्यासाठी सिरोटोनिनचा रोल आहे. इन्क्रीज द लेवल ऑफ सिरोटोनिन लीड्स टू कॉज सायकोसिस अँड डिक्रीज द लेवल ऑफ सिरोटोनिन लीड्स टू कॉज डिप्रेशन. Neurohumoral transmission in the CNS, that is gamma, inhibitory neurotransmitter, reduce neuronal excitability, target for sedative and anti-anxiety drugs. Glutamate, excitatory neurotransmitter, involved in memory, learning, dysregulation linked to the neurodegenerative disease. Glycine, inhibitory neurotransmitter, regulate motor control, targets for muscle relaxant. Serotonin, affect mood, appetite, sleep, target for antidepressant. Dopamine, involved in reward and motor control, imbalance linked to the Parkinson disease, schizophrenia. म्हणजे सिरोटोनिनची लेवल जर इन्क्रीज झाली तर सायकोसिस, सिरोटोनिन लेवल जर डिक्रीज झाली तर लीड्स टू कॉज डिप्रेशन. म्हणजे जर डिप्रेशन ट्रीट करायचं असेल तर अँटीडिप्रेसंट ड्रग्स असतील, म्हणजेच ट्रायसायक्लिक अँटीडिप्रेसंट, इमिप्रॉमाइन किंवा फ्लॉक्झाटिन, सिलेक्टिव्ह सिरोटोनिन रिॲप्टेक इनिबिटर. जनरल अनास्थेटिक एक्झाम्पल हॅलोथेन, इंट्राव्हेनस, प्रोपोफॉल, इंडोस अनास्थेशिया बाय एनहान्सिंग गॅबार्जिक ट्रान्समिशन और इनिबिशन NADA रिसेप्टर. युटिलाइज केले जातात किंवा इनहेलेशन, हॅलोथेन्स किंवा नायट्रस ऑक्साईड. हे जे ड्रग्स आहेत ते काय आहेत, जनरल अनास्थेटिक, म्हणजे होल बॉडीला जर आपल्याला सर्जरी करायची असेल तर त्या कंडिशनमध्ये जनरल अनास्थेटिक्स ड्रग्स आपण देतो. तर जनरल अनास्थेटिक्समध्ये स्टेजेस आहेत, स्टेज ऑफ अनाल्जेसिया, सेकंड स्टेज स्टेज ऑफ डेलिरियम और एक्साइटमेंट, थर्ड स्टेज ऑफ सर्जिकल अनास्थेटिक्स आणि फोर्थ स्टेज ऑफ रेस्पिरेटरी पॅरालायसिस. जनरल अनास्थेटिकमध्ये स्टेज ऑफ अनाल्जेसिया extend from beginning of inhalation anesthesia, loss of consciousness. Stage 2 delirium मध्ये excitement, loss of consciousness, beginning of surgical anesthetics. Stage of surgical anesthesia, plain 1. Respiration full regular deep, pupil normal size. Stage 4 मध्ये respiratory paralysis, dilated pupil reacting to light. So you have to remember the 4 stage. Pre-anesthetic medications, those medications which administered before the anesthetic conditions. Pre कशासाठी गरज आहेत? To avoid the excitement, to avoid the anxiety. पेशंट कधी कधी खूप अँझायटी चिंता करतो, त्याच्यामुळं त्याचा परिणाम त्याच्या सर्जरी होऊ शकतो. तर ते अवॉइड करायचं असेल तर प्री अॅनास्थेटिक मेडिकेशन्स, बेन्झोडायझेपिन रिड्यूस द अँझायटी आणि नर्स गाबार्जिक ॲक्टिव्हिटी. अँटीकोलोनर्जिक एक्झाम्पल ॲट्रोपिन रिड्यूस द सिक्रेशन अँड प्रिव्हेंट ब्रॅडिकार्डिया. अनदर सिडेटिव्ह अँड हिप्नॉटिक अँड मसल रिलॅक्झंट. आता सिडेटिव्ह काय आहेत? इट डज नॉट प्रोड्यूस द स्लीप, इट प्रोड्यूस द कामनेस. हिप्नॉटिक्स द ड्रग विच प्रोड्यूस द sleep as like to natural sleep. Muscle relaxant, the sedative, hypnotics and muscle relaxant, benzodiazepine, lorazepam, barbiturate. Non-benzodiazepine hypnotics, zolpidem, baclofen, GABA B receptor agonist, reduce tizanidine, alpha 2 adrenergic agonist, reduce muscle tone and spasticity. Antiepileptic, epilepsy, sudden discharge of neurons, firing of neurons. Tonic, clonic, aclonic, that is the epilepsy. So antiepileptic means the drugs which used in the treatment of epilepsy. Example कोणते? Phenytoin inhibit the sodium channels, stabilize the neural membrane and treat partial and generalized seizure. Valproic acid increase the GABA level, inhibit the sodium channels, broad spectrum antiepileptic. Carbamazepine inhibit sodium channel, treat partial seizure. आणि अल्कोहोल आणि डायसल्फिरम. अल्कोहोल आणि डायसल्फिरम काय? अल्कोहोल ॲडिक्शन जर ट्रीट करायचं असेल तर डायसल्फिरम हा ड्रग युटिलाइज करतो, म्हणजेच एक अँटीडोट. अल्कोहोल इनहन्स गाबार्जिक ॲक्टिव्हिटी अँड इनिबिट ग्लुटामेट रिसेप्टर CNS डिप्रेसंट विथ ॲडिक्टिव्ह प्रॉपर्टीज. डायसल्फिरम इनिबिट अल्डिहाइड डिहायड्रोजनेस एन्झाईम कॉजिंग ॲस्टॅल्डिहाइड and build up the user to deter alcohol consumption. जे डायसल्फिरम काय? इनिबिट द aldehyde dehydrogenase causing acetaldehyde buildup. So this is an antidote. So alcohol, when we administer the person of alcohol, that time CNS depress activity, dose dependent activity, heart rate also increases, speech, uncontrolled speech, salivary secretions also more, that person suffer from acidity, peptic ulcer likewise. So this prevention of alcohol consumptions, let's know about the treatment, that is disulfiram. Once the disulfiram compound is administered that patient and then again administer the alcohol, resulting in vomiting as well as serious adverse drug reactions is caused. So alcohol and disulfiram in the chapters. So questions, multiple choice questions. Which of the following neurotransmitter is primarily involved in inhibitory neurotransmitter in CNS? A. Glutamate, B. Dopamine, C. GABA and D. Serotonin. Inhibitory questions आहे. तर इनिबिटरी कोणता आन्सर आहे? गॅमा अमोनोब्युटरिक ॲसिड. The following neurotransmitter is primarily involved inhibitory neurotransmitter in CNS. Next, which neurotransmitter is most commonly associated with excitatory synaptic transmission in the CNS? Glutamate. Next, dopamine is particularly important in which following function? Dopamine, the regulation of sleep-wake cycle, that is serotonin work. Another B, motor control and reward pathways, inhibition of neuronal activity, and D, modulation of blood pressure. So motor control and reward pathway, that is the work of dopamine. Next, which neurotransmitter is involved in the modulation of mood, sleep and appetite? Option A, serotonin, B, glycine, C, gamma aminobutyric acid, D, glutamate. Serotonin is the correct answer. Next, which of the following agent is commonly used as a pre-anesthetic medication to reduce the anxiety? So ketamine, isoflurane, propofol is the anesthetic drugs, but midazolam is a pre-anesthetic medication. Next, which of the following is commonly used in inhalational general anesthetics? Example: propofol, A, B, ketamine, C, isoflurane, and D, sevoflurane. 6C, isoflurane is the correct answer. Next, which of the following is general anesthetics is known for its ability to induce both anesthesia and analgesia? Ketamine is the correct answer. Nitrous oxide is also called as laughing gas. Poor muscle relaxant property, commonly used gas आहे inhaled anesthesia, good for analgesic property आणि पुअर मसल रिलॅक्संट प्रॉपर्टी आहे. पण ॲडवर्ट ड्रग रिॲक्शन काय आहे नायट्रस ऑक्साईडची हायपॉक्झिया, यू हॅव टू रिमेंबर. किंवा रेस्पिरेटरी डिप्रेशन, बोन मॅरो डिप्रेशन, कार्डियक इरेग्युलेटरी. नायट्रस ऑक्साईड इज अ laughing gas also called, so you have to remember. Next, which of the following drug is used as a centrally acting muscle relaxant? Baclofen. Next, which of the following is sedative and hypnotic agent is the most commonly used in the treatment of insomnia? A, diazepam, B, zolpidem, C, chlorpromazine, and D, melatonin. Zolpidem. Insomnia means imbalance in sleep. Next, which of the following drug used in the first line treatment of generalized tonic-clonic seizure? Option A, phenytoin, B, lamotrigine, C, valproic acid, and D, carbamazepine. C is the correct answer, valproic acid. Next, which of the following is the primary mechanism of action of phenytoin in the treatment of seizure? A, inhibition of sodium channel, B, enhancement of GABA release, B, blockage of calcium channel, D, inhibition of glutamate receptor. 12th A, inhibition of sodium channel. Next, disulfiram is used in the treatment of alcoholism. What is its primary mechanism of action? Inhibit aldehyde dehydrogenase enzyme. You have to remember. Which of the following is the common effect of alcohol consumption on the CNS? Sedation and euphoria. And this is next last unit, pharmacology of drug acting on central nervous system, psychopharmacological agent, antipsychotics, the drugs or substances used in the treatment of psychosis. Antidepressant, the drug or substances used in the treatment of depression. Depression is a sadness, unhappiness, that is the sign and symptoms. Anti-anxiety, the drug or substances used in the treatment of anxiety. It is also called as minor tranquilizer, and psychosis is also called as major tranquilizer. Antimanics, mania. Mania is a bipolar disorder. Hallucinogens, the agent which create the hallucination. Drug used in the Parkinson, motor disorders, decrease the level of dopamine, and Alzheimer's disease decrease the level of acetylcholine, means leads to memory, and Parkinson leads to movement. CNS stimulant, the drug or substances which stimulate the CNS, example caffeine, nootropics, the drug or substances increase the memory. Opioid analgesic and antagonist, including addictions, abuse, tolerance, and dependence. So questions will discuss. Which of the following is drug is classified as an atypical antipsychotic? Atypical question. A, haloperidol, C, clozapine, fluphenazine, and D, chlorpromazine. Atypical. Clozapine. Next, which of the following is a common side effect of first generation antipsychotic drugs, typically antipsychotic? A, weight gain, B, extrapyramidal symptoms, C, sedation, and D, none of these. Extrapyramidal symptoms. Next, which class of drug is commonly used to treat depression by inhibiting the reuptake of serotonin? A, monoamine oxidase inhibitor, B, tricyclic antidepressant, C, selective serotonin reuptake inhibitor, and D, serotonin norepinephrine reuptake inhibitor. selective serotonin reuptake inhibitor SSRI, fluoxetine example. Which of the following drug is most commonly used in treatment of generalized anxiety disorder CAD? A. Diazepam, B. Buspirone, C. Imipramine, D. Lorazepam. Buspirone. You have to remember which of the following drug is used in treatment of mania in the bipolar disorder. Mania, mood swing म्हणतो आपण त्यालाच. Lithium, B. Fluoxetine, sertraline and diazepam. Diazepam is serotonin hypnotic. Fluoxetine is the antidepressant. Lithium is the treatment of mania bipolar disorder. Next, which of the following is hallucinogenic drugs act primarily on serotonin receptor? All of the above. म्हणजे hallucinogenic means it can cause hallucination म्हणजे false perception, म्हणजे जे नाही आहे ते आहे असं वाटतं, बास म्हणतो आपण त्यालाच. हॅल्युसिनेशन म्हणजेच काय, फॉल्स बिलीफ किंवा फॉल्स इमॅजिनेशन्स किंवा फॉल्स इंटरप्रिटेशन्स. नेक्स्ट, विच ऑफ द फॉलोइंग ड्रग इज कॉमनली यूज्ड इन द इनक्रीज द डोपामार्जिक ॲक्टिव्हिटी इन पार्किन्सनिझम डिसीज? ए. डोन्झापिल, B. Levodopa, C. Galantamine and D. Rivastigmine. Levodopa, it can cross the blood-brain barrier and commonly used in the dopaminergic activity. Next, which following drug is used in treatment of Alzheimer disease? Means it decreases the level of acetylcholine. A. Levodopa, Donzapil, C. Memantine, D. Siligilin. Donzapil. Next, which of the following CNS stimulant is commonly used in treatment of attention deficit hyperactivity disorder ADHD? A. Methylphenidate, B. Modafinil, C. Atomoxetine and D. Caffeine. CNS stimulant used in treatment of attention deficit hyperactivity disorder. Caffeine also used for CNS stimulant. Next, which of the following is nootropic drugs is used to enhance cognitive functions in elderly individual or patient with dementia? Ginkgo biloba. Next, which of the following is opioid drug is considered the gold standard for severe pain management? Morphine. Which of the following is a opioid antagonist used in the treatment of opioid overdose? Naloxone. पहिल्यांदा सांगितलं होतं आपल्याला. Next, which of the following statement is true regarding opioid tolerance? Tolerance म्हणजे काय, result in need of higher dose to achieve same effect. Tolerance, repeated administration of drugs decrease the responsiveness. Next, which of the following is a common side effect of opioid drug? Opioid use: diarrhea, B. increased appetite, C. constipation, D. hypotension. Constipation, morphine side effect. Pharmacology of drug acting on central nervous system. Psychopharmacological agent, antipsychotic, treat schizophrenia and bipolar disorder by blocking the dopamine receptor and can cause movement disorder. Example, tardive dyskinesia. Antidepressant, increase neurotransmitter level, serotonin, norepinephrine. Types include SSRA, TCA, and EMA, MAO. Side effect: weight gain. Anti-anxiety drugs, benzodiazepine. Anti-anxiety कशा म्हणतो, द एजंट विच ट्रीट द अँझायटी. एक्झाम्पल कोणतं, डायझेपम. इनन्स काय करणार ते, गाबा, गॅमा अमोनोब्युटरिक ॲसिड. बुस्पिरॉन इज अ नॉन बेन्झोडायझेपिन अल्टरनेटिव्ह. साईड इफेक्ट काय होणार पण नाही ना, ड्रॉजिनेस and dependency. Antimanic, lithium stabilize mood in bipolar disorder, while anticonvulsant, example valproate, are also used. Hallucinogens alter perception. Parkinsonism and Alzheimer disease. Parkinson मध्ये काय, ट्रीट डोपामार्जिक एजंट लिओडोपा and MAO-B inhibitors, but साइड इफेक्ट काय, डिस्कायन्सिया. आणि अल्झायमरमध्ये treated with cholinesterase inhibitor, example donepezil, and NMDA antagonist, example memantine. So antipsychotics, remember the drug or substances used in treatment of psychosis. Example कोणते drugs आहेत antipsychotics? Phenothiazine. Antidepressant, the drug or substances used in treatment of depression. एक्झाम्पल फ्लोक्झाटिन किंवा इमेप्रोमाइन. अँटी-एझायटी द ड्रग और सबस्टन्सेस यूज्ड इन ट्रीटमेंट ऑफ अँझायटी. एक्झाम्पल बेन्झोडायझेपिन. Antimanics the drug or substances used in treatment of mania bipolar disorder. Example lithium. Parkinsonism is a motor disorder. Drug is that is dopamine, levodopa, carbidopa. Alzheimer decrease the level of acetylcholine level, neurotransmitter. Example promote donzapil and NMDA antagonist. CNS stimulant and nootropics. CNS stimulant used in ADHD and narcolepsy. Example amphetamine, methylphenidate. Amphetamine CNS stimulant. Side effect काय पण insomnia, addiction, risk. CNS stimulant means increase the functions of CNS. Opioid analgesics and antagonist. Opioid analgesic means relieve the pain. Pain have two types: chronic pain and acute pain. Acute pain shorter duration. Chronic means longer duration. The relief पेन करायचं असेल तर मॉर्फिन, फेंटॅनिल. साईड इफेक्ट काय पण त्याचे कॉन्स्टिपेशन अँड ॲडिक्शन. ओपॉइड अँटागोनिस्ट कोणते आहेत? रिव्हर्स ओव्हरडोस नॅलोक्झोन और ट्रीट ॲडिक्शन. एक्झाम्पल मिथॅडोन. ॲडिक्शन अँड डिपेंडन्स टॉलरन्स रिड्यूस ड्रग इफेक्टिवनेस ओव्हर अ टाईम. डिपेंडन्स विड्रॉल सिम्टम्स when drug use and stop. Addiction compulsive drug use in despite harm. द नेक्स्ट रेफरन्स बुक्स सिलेबस कॉपीमध्ये दिलेले आहेत. रँगेंडेल, गुडमन अँड गिलमन, के.डी. त्रिपाठी, एफ.एस.के. बरार, सातोस्कर अँड भंडारकर. प्रिव्हियस इयर क्वेश्चन्स. द क्वेश्चन्स काय विचारलेले आहेत? राईट इन डिटेल सोर्सेस अँड ॲक्टिव्ह इन्ग्रेडियंट ऑफ ड्रग्स. सोर्सेस बघितलं तर आपण प्लांट सोर्सेस, ॲनिमल सोर्सेस अँड मिनरल सोर्सेस अँड बायोटेक्नॉलॉजिकल सोर्सेस. अनदर इनलिस्ट द डिफरन्स बिटवीन सिम्पॅथोमायमॅटिक्स अँड सिम्पॅथोमायमॅटिक्स अँड पॅरासिम्पॅथोमायमॅटिक्स. आता डिफरन्स काय? सिम्पॅथोमायमॅटिक्स काय? द एजंट विच increase the activity of sympathetic nervous system, and parasympathetic nervous system increase the activity of peripheral nervous system or parasympathetic nervous system. Another, explain the drug addiction with suitable example. Another, define efficacy and affinity and therapeutic index. Therapeutic index काय सांगितले? lethal dose and effective dose. It is the ratio of lethal dose and effective dose. सेफ्टी मेजर करण्यासाठी थेरपॅटिक इंडेक्स युटिलाइज करतो आपण. अनदर, एक्सप्लेन द इम्पॉर्टन्स ऑफ फार्माकोव्हिजिलन्स. फार्माकोव्हिजिलन्स कशाला? मॉनिटरिंग ऑफ ड्रग ॲडव्हर्स रिॲक्शन. नेक्स्ट, व्हॉट इज द मीन बाय ड्रग अँटागोनिझम. अँटागोनिझम कशाला म्हणता येईल? वेन सायमल्टेनियस ॲडमिनिस्ट्रेशन ऑफ टू ड्रग, वन ड्रग अपोज ॲक्शन ऑफ अनदर ड्रग्स, दॅट इज अँटागोनिझम. 10 मार्कला क्वेश्चन्स. एक्सप्लेन इन डिटेल व्हेरियस रूट्स ऑफ ॲडमिनिस्ट्रेशन विथ देअर ॲडव्हान्टेजेस अँड डिसॲडव्हान्टेजेस. Next, define and classify adrenergic drugs with example, basis of their therapeutic uses. Explain pharmacological details of adrenaline. C. Define and classify drug interaction. Explain pharmacokinetics and pharmacodynamic drug interaction with example. D. Classify opioid analgesic. Write pharmacological details of morphine. 5 marks question. Write a note on transport of drug across plasma membrane. Next, define and classify local anesthetics. Explain mode of action and adverse effect of lignocaine. Next, explain G protein coupled receptor. G protein coupled receptor काय? मेजर फॅमिली रिसेप्टर आहे, म्हणजे लार्जेस्ट रिसेप्टर क्लास आहे. याच्यामध्ये डोपामाइन रिसेप्टर असेल, सेरोटोनिन असेल, ॲड्रेनर्जिक असेल, एक्सेट्रा. नेक्स्ट, डिस्कस फेजेस ऑफ क्लिनिकल ट्रायल्स. फेज 1, फेज 2, फेज 3 आणि फेज 4. नेक्स्ट, डिस्कस द टर्म anxiety and add a note on anxiolytics. Anxiolytics कशा म्हणतात? द ड्रग or substances used in the treatment of anxiety. Next, write a note on adverse drug reaction, abnormal response of drug. Next, write a note on Dell's vasometer reversal. Another, define and classify antidepressant, add a note on MAO inhibitor. Another, pharmacotherapy of myasthenia gravis. And last, define and classify antiepileptics. Write a mode of action and therapeutic use of phenytoin. So this is the previous year question paper. Next, second previous year question paper. What are CNS stimulant? Write their example and uses. Define and classify drug antagonism with example. Define tachyphylaxis and give their two example. Define hypnotics and give two example. Hypnotics काय? The drug used in the treatment of insomnia. Hypnotics example diazepam आहे, barbiturate आहे, lorazepam आहे. Pharmacovigilance काय? The monitoring of adverse drug reaction. Drug interaction simultaneous admission of two drug, one drug alters the action of another. आणि क्लासिफाय काय ड्रग इंटरॅक्शनचे फार्माकोकायनेटिक्स आणि फार्माकोडायनॅमिक क्लास इंटरॅक्शन्स आहेत. ड्रग डिपेंडन्स विथ एक्झाम्पल मॉर्फिन असेल किंवा कोकेन असेल, हे ड्रग डिपेंडन्स कॉज करू शकतो. अब्झॉर्प्शन अँड नेक्स्ट 10 मार्क क्वेश्चन. व्हॉट इज ड्रग अब्झॉर्प्शन? डिस्क्राइब द व्हेरियस मेकॅनिझम ऑफ ड्रग अब्झॉर्प्शन अँड एक्सप्लेन द फॅक्टर्स अफेक्टिंग अब्झॉर्प्शन. आता फॅक्टर्स कोणते अफेक्ट होतात अब्झॉर्प्शनसाठी? पार्टिकल साईज असेल, नेचर असेल ड्रगचं, लिपोफिलिक आहे, हायड्रोफिलिक आहे किंवा अनदर सोल्युबिलिटी, हे जे आहेत ते फॅक्टर्स अफेक्ट होतात, किंवा बाइंडिंग प्रोटीन एक्सेट्रा. नेक्स्ट डिफाईन अँड क्लासिफाय सेडेटिव्ह अँड हिप्नॉटिक्स विथ एक्झाम्पल अँड राईट अ फार्माकोलॉजिकल इफेक्ट अँड युजेस ऑफ देम. नेक्स्ट डिफाईन अँड classify clinical trials with details, design and data collected. Add a note on pharmacovigilance. Next, define and classify parasympathomimetics agent with suitable example. Explain biosynthesis, storage and release of and metabolism of acetylcholine. Next, classify antiepileptic drugs. Describe the mechanism of action, therapeutic uses and adverse effect of valproic acid. Next, define and classify antipsychotic drugs. Write on a uses, mode of actions, adverse effect of chlorpromazine. Next, define and classify general anesthetics and write a note on stages of anesthesia. 4 stages सांगितले होते. Stage of analgesia, stage of delirium and excitement, stage of surgical anesthesia and stage of respiratory paralysis. म्हणजे 4 स्टेज आहे. स्टेज ऑफ analgesia, स्टेज ऑफ delirium excitement, स्टेज ऑफ surgical anesthesia and last stage of respiratory paralysis. Next, enumerate opioid analgesic. Describe the therapeutic uses and adverse effect of morphine. Next, explain pharmacokinetics terms, bioavailability and half-life in detail. Classify various drugs used in the treatment of Parkinson's disease. Explain why levodopa combined with carbidopa. Next, define the drug distribution. Write factors affecting it and add a note on volume distribution. Next, classify various beta blockers. Describe the clinical uses of beta blocker. What is rational drug therapy? And define and classify drug interactions. Explain drug receptor interactions. Okay, theory is completed. Next, we turn to the practical. Total 15 practicals according to your syllabus is there. Introduction to experimental pharmacology. First practical. Experimental means testing of drug effect on animal being or as well as human beings. Main objective to find the safety or efficacy of drug. Second, commonly used instrument in experimental pharmacology. Third, study of common laboratory animals and its possible use. Fourth, maintenance of laboratory animals as per CPCSCA guidelines. Fifth, common laboratory techniques, blood withdrawal, serum and plasma separation, anesthetics and euthanasia used for animal studies. And sixth, study of different routes of drug administration in mice and rat. 7, study of effect of hepatic microsomal enzymes inducer on the phenobarbital sleeping time in mice. Next, efficacy of drugs on ciliary motility of frog oesophagus. Effect of drug on rabbit eye. 10, effect of skeletal muscle relaxant using rotor rod apparatus. Effect of drug on locomotor activity using actophotometer. Anticonvulsant effect of drug by MES and PTZ method. Study of stereotype and anticatatonic activity of drug on rat or mice. Study of anxiolytic activity of drug using rat or mice. And the last one, study of local anesthetics by different methods. So these are the pharmacology practicals. Next, instruments or equipment used in pharmacology. Organ bath used for study of drug action. Rotor rod apparatus used to study muscle relaxant activity. Actophotometer, it is used in the CNS stimulant and depression property of drug. Electroconvulsometer, instrument used in the study of anticonvulsant activity. Pole cleaning apparatus, study of antipsychotic drugs. Analgesimeter, study of analgesic. Metabolic case, student organ bath, used to record contractions or relaxations of isolated tissue. Sherrington rotating drum, study the bioassay. Elevated pulse means apparatus, used for study of anti-anxiety किंवा anxiolytic drugs. दोन पेस आहेत, एक क्लोज आर्म आहे आणि ओपन आर्म आहे. जर माईसला सांगितलं की टर्न कर ओपन आर्ममध्ये आणि क्लोज आर्ममध्ये, म्हणजे डार्क लाईट आणि ओपन लाईट, म्हणजे जिथं लाईट आहे आणि तिथं अंधार आहे. समजा जो प्राणी फिअर म्हणजे भीतीने सफर आहे तो डार्क लाईटमध्ये जाणार आहे, आणि जो फिअरमधून फ्री आहे तो काय होणार, लाईटमध्ये येणार आहे. दॅट मीन्स ॲपरेटस, दॅट इज मीन्स एलिव्हेटेड प्लस मीन्स ॲपरेटस. सो फर्स्ट एक्सपेरिमेंटमध्ये काय सांगितलं, इंट्रोडक्शन टू एक्सपेरिमेंटल फार्माकोलॉजी, अंडरस्टँडिंग हाऊ ड्रग अफेक्ट लिव्हिंग ऑर्गॅनिझम. मग त्याच्यामध्ये इनव्हिट्रो ड्रग स्टडी, इन व्हिवो म्हणजे प्री क्लिनिकल स्टडी आणि क्लिनिकल स्टडी. प्री क्लिनिकल म्हणजे स्टडी ऑफ ॲनिमल्स आणि क्लिनिकल मीन्स स्टडी ऑफ ह्युमन बिंग्स. म्हणजे त्याच्यामध्ये क्लिनिकलमध्ये फेज 1, फेज 2, फेज 3 आणि फेज 4. इन्स्ट्रुमेंटमध्ये कॉमन इन्स्ट्रुमेंट लाईक सिरिंज, बॅलन्स स्केल, जे शेरिंग्टन रोटेटम ड्रम बघितलं तुम्ही. आता जे सेकंडचे इन्स्ट्रुमेंट्स होते किंवा एलिव्हेटेड प्लस मेज ॲपरेटस, हे इन्स्ट्रुमेंट तुम्ही सेकंड एक्सपेरिमेंटमध्ये लर्न करणार आहेत. थर्डमध्ये काय, लॅबोरेटरी ॲनिमल्स कोणते कोणते आहेत, माईस असेल, रॅट असेल, गण्या पिग असेल किंवा फ्रॉग्स असेल फॉर युजिंग टेस्टिंग. ॲनिमल केअर, CPCSC गाईडलाईन्स. आता CPCSC म्हणजे काय, कमिटी फॉर द कंट्रोल अँड सुपरविजन ऑफ एक्सपेरिमेंटल ॲनिमल्स. ही सेंट्रल गव्हर्नमेंटनं कमिटी इस्टॅब्लिश केलेलं आहे फॉर ॲनिमल केअर टू अवॉइड द अननेसेसरी पेन टू द ॲनिमल. इन्स्टिट्यूशनल लेवलला IAC, इन्स्टिट्यूशनल ॲनिमल इथिकल कमिटी, आणि सेंट्रल लेवलला कमिटी फॉर द कंट्रोल अँड सुपरविजन ऑफ एक्सपेरिमेंटल ॲनिमल्स गाईडलाईन्स. त्या गाईडलाईन्स काय प्रोव्हाइड केलेल्या आहेत, टू डू नॉट प्रोव्हाइड अननेसेसरी पेन ऑन ॲनिमल. फर्स्ट गाईडलाईन्स. सेकंड काय सांगितले गाईडलाईन्स त्याच्यामध्ये, की जे ॲनिमल्स आहेत त्यांना प्रॉपरली डिस्पोज केलं पाहिजे किंवा त्या ॲनिमलची केअर प्रॉपरली घेतली पाहिजे, किंवा एखादी टेस्टिंग करायची आहे, नवीन रिसर्च करायचं आहे, त्यामध्ये खूप जास्त ॲनिमल युटिलाइज नाही केले पाहिजेत, मिनिमम युटिलायझेशन्स. अशा गाईडलाईन्स आहेत, ह्या तुम्ही एक्सपेरिमेंट नंबर 4मध्ये लर्न करणार. नेक्स्ट, कॉमन लॅबोरेटरी टेक्निक्स, ब्लड विड्रॉल, सिरम सेपरेशन, इथन्सिया म्हणजे गुड डेथ, कलेक्टिंग ब्लड फ्रॉम रॅट टू द मेजर ड्रग लेवल, ड्रग ॲडमिनिस्ट्रेशन रूट, इन दॅट ओरल असेल, इंट्राव्हेनस असेल, टॉपिकल असेल, हे रूट्स आहेत, हे लर्न करणार तुम्ही. नेक्स्ट काय, हिपॅटिक मायक्रोझोमल एन्झाईम इंड्युसर. आता एन्झाईम इंड्युसर काय सांगितलं आपण, की एन्झाईम इंड्युसर जर मोर असतील तर फार्माकोलॉजिकल ॲक्शन काय होणार आहे, डिक्रीज होणार आहे. स्टडिंग हाऊ लिव्हर एन्झाईम अफेक्ट ड्रग मेटाबॉलिझम, ऑब्झर्विंग हाऊ फिनोबार्बिटल अफेक्ट स्लीप ड्युरेशन इन माइस. Another, ciliary motility frog esophagus, testing drug on frog esophagus for mortality changes. Celerity movement, drug effect on rabbit eye. आयवर काय होणार, मिओसिस होणार आहे की मायड्रेसिस, म्हणजे पपी साईज लार्ज होणार आहे की स्मॉल होणार आहे, हे ऑब्झर्व करायचं आहे. अप्लाइंग लोकल अनेस्थेटिक्स टू रॅबिट आय टू टेस्ट इफेक्ट. Skeletal muscle relaxant, rotor rod apparatus, studying the muscle relaxant by using rotor rod apparatus. Diazepam. Locomotor activity, actophotometer, measuring the movement using actophotometer, studying caffeine stimulating effect at movement. Anticonvulsant effect, PTZ method. Stereotype and anticatatonic activity, observing behavioral changes in rodent. Anxiolytic activity, testing of anxiety reducing drugs, example administering diazepam to reduce anxiety in mouse. Local anesthetics, using lidocaine to the test in effect in rats and tail. So these are the all of the practicals, reference books for practicals. Kulkarni SK, Handbook of Experimental Pharmacology, Vallabh Prakashan. These are the list of experiment. These are the list of books reference for practical. तर ह्या लेक्चर we seen in all the points of pharmacology 1. I hope you understand, and this definitely helpful for uh, various competitive examinations. Each and every competitive examination, pharmacology, drug acting on central nervous systems, general pharmacology, definitely questions will ask. So make it strong. Take a print of classification book, and that classification book you have to write mode of actions, uses, adverse drug reactions, another side effects, that आणि recall आणि revise consistency. जो आपण मेसेज सांगितला की टुडेज प्रिपरेशन इज द डेव्हलपमेंट ऑफ टुमॉरोज सक्सेस. एव्हरी स्टेप यू टेक, नो मॅटर हाऊ स्मॉल, डेव्हलप द पाथ टू द एव्हरी ड्रीम्स. स्टे फोकस्ड, स्टे वर्क अँड ट्रस्ट द प्रोसेस. सक्सेस इज द रिवॉर्ड ऑफ persistence and passion. सो स्कोप बघितला, आपण ऑब्जेक्टिव्ह बघितले, जनरल फार्माकोलॉजी 1चे युनिट्स, मल्टिपल चॉईस क्वेश्चन्स, फार्माकोकायनेटिक्स म्हणजे काय, okay. Last, thank you everyone for this watching this video in advance, and good luck your preparations. Thank you.